happening in the ovaries. We're just preparing an egg to be ready for potential fertilization. We have not actually talked about fertilization. I mean, we did as I was answering some questions, but not as part of this discussion. The sexual cycle, which can also be called the uterine cycle, or sexual cycle, which is also called uterine and ovarian cycle, is an average of 28 days. A lot of people with ovaries have shorter, longer cycles. They can vary between 20 to about 45 days. Nice thing about having a longer cycle is you menstruate less frequently, but it also means less opportunities to get pregnant. There's also a correlation if a person has a particularly short cycle or a particularly long cycle, that it decreases their fertility for reasons not fully understood, but that's all just for fun. So we're going to look at it as if it's 28 days. Be aware, most women are not 28 days, because this is an average number. The first day of the cycle is marked when blood appears on the outside, because that is the first visible and easy to identify point. This is not when internal bleeding begins. That began a couple of days at least before. It just took this long for it to come out for the first time. Okay. The cycle in general is regulated by hypothalamo-pituitary-ovarian axis. Again, that just means an interplay between the hormones released by hypothalamus, the hormones released by anterior pituitary, and hormones that are released by the ovaries. Okay. So, hypothalamus releases what? In general, we know that's related to this is gonadotropin-releasing hormone, same as in the male. In the male, gonadotropin-releasing hormone is basically pulsating at all times. There's just like a bit of it released every like 90 minutes or something. In the female, it's not that consistent. It varies throughout the cycle, but we're not going deeper into that. This hormone, gonadotropin-releasing hormone, travels very short distance, mostly to the anterior pituitary. Not much of it goes into the general circulation, and it stimulates the anterior pituitary cells to create two hormones. What are they? LH and FSH, right? And luckily, because this was studied in the female, the names are actually a little more descriptive for the female, like what does FSH stand for? Follicle stimulating hormone. It stimulates the follicle, right? Okay, luteinizing hormone. What do you think that's named after? Corpus luteum, yeah. It's because that's when it was that's where it plays the biggest role. That's where the name came from. Okay. So hypothalamus releases gonadotropin-releasing hormone, stimulates anterior pituitary to create FSH and LH. They do not necessarily get secreted at the same time, but they do get made at the same time due to the stimulation. The follicle stimulating hormone will get created and secreted, luteinizing hormone will get created, but secretion will be delayed. We'll talk about that. And it goes through the general circulation and it reaches various different areas, but we care that it has an effect on ovaries. Granulosa cells and Teca cells have receptors for these hormones. So they're going to be sensitive to those hormones, and they're going to be stimulated to make some internal changes, and then those cells are going to make estrogen, or estradiol specifically. We'll just use those interchangeably for now, and also progesterone and inhibin, depending on the folliculogenesis stage. So we're going to come to that. Then the estrogen and the progesterone, depending on the part of the cycle that are released by the ovaries, are going to affect the uterus. And this is where that cycle of menstruation is coming from, is that depending on the hormones that are being secreted by the ovaries, specific specifically by the follicles or granulosa cells and theca cells, it's going to affect the lining of the uterus. What is the name of that layer of the uterus? Endometrium. Yeah, endometrium is going to become thicker and fluffier, full of glands that are secreting this glycoprotein rich kind of jelly type thing to prepare for potential implantation. And then if implantation doesn't happen, how does it know it doesn't happen? Is because of a change in the hormones coming from the ovaries. Then it'll just rip down most of the endometrium, the stratum functionalis. That will come out of the vagina, and that's what we see at menstruation. Okay, so we're gonna see how this all comes together, and then we'll do our little practice thing. If we're looking at the 28-day cycle from beginning of bleeding until the day before a person begins to bleed again, that's the 28-day cycle. The first 14 days are called the follicular phase, because this is where the follicle is, the follicles of the chosen cohort are growing and developing. Specifically, FSH is going to have the big effect here, because FSH stands for follicle stimulating hormone. It recruits a cohort of primary follicle and stimulates their growth. As granulosa cells of those follicles grow, and the antral follicles of the later cohort are growing, they secrete estrogens, specifically estradiol. Again, you can use those interchangeably for everything from here on out. The more estrogen is released, the more it signals to the hypothalamus and the anterior pituitary, and inversely, low estradiol inhibits FSH. High estradiol is going to stimulate it to a point, and then very high is going to shut it down again. It can't really get any more confusing. Okay, we're going to kind of come back to this. A spike in luteinizing hormone at the end of this cycle, or at the end of this 14-day phase, and also spike in FSH, is when the primary oocyte completes meiosis 1, and you start getting the buildup of antral fluid or follicular fluid to become an antral follicle. Okay, that's a lot of different things overlapping. Go ahead and take a look at the different diagrams for a moment. I'm going to blank this for a second because I wanted to share with you a diagram from a different book that I found helpful, but I only have it as a PDF, and so I can't stick it into the, I guess I could have made a picture of it. see if I can. Okay, this is from the Martini Visual Anatomy and Physiology. I know some of you have this book. It's, I think, out of print as of this year, so, but I really like it. So look at it in, oh no, what is happening? Oh my gosh. What are things popping up at me? Let's see if I can make this. Is that possible to read, or is that way too small? All right, just read the intro there. And go ahead and read this number 1. As in males, gonadotropin-releasing hormone from the hypothalamus regulates reproductive function in females. Females, it changes throughout the ovarian cycle, and then it shows you kind of what that cycle will be like with these kind of purple numerations. So number 1, release of gonadotropin-releasing hormone. Ovarian cycle begins with the release of it, which stimulates production and secretion of FSH and production of LH. At first, LH is not secreted. All right, so this top part, I think we should all have under control and understanding of that. GnRH stimulates anterior pituitary to make the gonadotropins, which are LH and FSH. Any questions there? All right. In the follicular phase of ovarian cycle, which we just talked about, FSH stimulates some secondary follicles. I know in the picture before, it said primary follicles. It's technically doing that to both, but the primary follicles are going to be in a later cohort that are behind, whereas the secondary follicles are going to be the ones that will end up getting a mature ovulation follicle. So we're going to focus on the ones that we ovulate. So follicular phase begins when FSH stimulates some secondary follicles to develop more by building a bigger antrum, more granulosa cells. They're all secreting estrogen, blah, blah, to become a tertiary follicle. Tertiary follicle is an antral follicle that has an obvious antrum. Okay. As secondary follicles develop, FSH levels decrease due to negative feedback and effects of inhibin. So this is the first time we're seeing this. Let's see it on this diagram. Production and secretion of FSH, which is stimulated by gonadotropin-releasing hormone, goes to the follicle and stimulates follicle development, secretion of inhibin, and secretion of estrogens. The estrogens are coming, and estrogens and inhibin are coming from those granulosa cells, and they will, as they become bigger, there's more and more of those two hormones, they will negatively feed back to anterior pituitary and decrease the secretion of FSH. Developing follicles secrete estrogens, especially estradiol, the dominant hormone prior to ovulation. In low concentrations, estrogen inhibits LH secretion. So at the beginning of this first 14 days, estrogen level is pretty low, and so it will inhibit LH. That's why you saw in the top part of this that GnRH, gonadotropin-releasing hormone, stimulates the formation of FSH and LH, but not the secretion of LH. It'll just store it in the cell, but not secrete it until after day 10 when estrogen has built up in the follicle. Okay, so for now, as the follicle develops and secretes estrogen, now estrogen is building up in the antrum and the blood stream. Granulosa cells will secrete estrogen, and it will go into the enteral fluid or follicular fluid and into the general blood circulation, because remember those TICA cells, they're attached to capillaries, and so it'll seep into the general blood circulation. So your general body estrogen will increase in those first 10, 14 days. Because that estrogen is circulating everywhere, it will have effects on the central nervous system. Various effects. We don't need to go into that, but there's some effects. It'll also stimulate bone and muscle growth. This is important because of what we'll talk about during menopause, is that having this estrogen baseline and as it's increasing is really important for bone growth and muscle growth. That means we inhibit osteoclasts and we stimulate osteoblasts. And it makes sense because you're preparing your body for potentially carrying a fetus in the next couple of weeks. So we really want to be in a good state of physical fitness for that. We also maintain female secondary sex characteristics, breasts, and all of that. Not pubic hair, that's actually due to testosterone, but basically breasts and other things. I don't know what else. Oh, labia are bigger. There's more lubrication that is possible for the vagina, all of those kinds of things. Okay. Other maintenance of other glands, and this is really relevant, stimulation of endometrial growth and secretion. This is when endometrium specifically will grow by mitosis to have many more cell layers and grow a big stratum functionalis, and glands will develop and start to secrete products of the glands. So from this, I may ask you, what is happening during follicular stage due to the effects of estrogen? Right? I'm gonna post this for you guys because it summarizes what we have in the PowerPoints pretty well. Okay, now this is gonna continue to happen, but there's gonna be a bit of a switch when the estrogen builds up in the circulation. It will turn on the secretion of luteinizing hormone. And that's about after day 10. Now, luteinizing hormone is going to be secreted into the general circulation, it's going to circulate around, get to the ovary, and it's going to stimulate the completion of meiosis 1 so we can have a secondary oocyte. It will then later stimulate ovulation, and even later, after ovulation, it will stimulate the formation of corpus luteum. That's the remainder of the follicle that has ovulated. When corpus luteum is developed, can you picture it? It's just like this yellow, empty looking sphere, stays in the ovaries, and now there's no oocyte in it, but those cells are stimulated by LH to begin changing, growing, and secreting progesterone. The progesterone is also going to spike and help the endometrium grow, but the point here is that we have an estrogen dominant phase of the whole cycle, and then it's followed by progesterone phase of the cycle. And that cutoff is right around ovulation. So we're going to look at that. before. So I do not have this in a form that I can put into a thing right now, but maybe I'll figure that out. Let's look really quick here. No. FSH is being released from anterior pituitary, and it's going to be stimulating these follicles to grow. As these granulosa cells are growing, what are they secreting?
Estrogen.
Estrogen, good. That estrogen is going to, at high levels, stimulate eventually LH to be released, more of it to be released. I know it looks like a bunch of stuff is already happening, but what we're trying to look at is the changes that take place. LH is going to be important in stimulating these leftover cells, which now look like that, to secrete progesterone. So you can see that progesterone is really high when we have corpus luteum, which is in the second half of the cycle, of the 28-day cycle. Why are we doing that? The goal of corpus luteum is to tell the rest of the body that there is an egg loose out there that at any moment may get fertilized, and when it gets fertilized, it needs to be implanted. So let's get everything ready to implant and support this egg. Remember, we do not have a placenta. Well, remember from lab, but we're not going to talk about it until next week. We do not have a placenta that can support the developing zygote and embryo. So corpus luteum is signaling that we need to develop all of the structures to support it and grow the placenta. So notice here, uterus is thin at the beginning of the cycle because it's just all bleeding out. Then it gets thicker and thicker and thicker as estrogen is stimulating it. And then it's going to reach its thickness right after ovulation. Why right after? Because it's going to take a few days from that oocyte bursting from the ovary to travel through the fallopian tube or uterine tube, get fertilized, and then keep traveling as it's fertilized, and then land on the pillowy, cushiony endometrium. So there is a lag of a few days here, about 5-6 days, from ovulation to where the endometrium is ready, because that's how many days the egg will travel to get to the actual uterus and implant in the endometrium. Okay.
Really quickly, so FSH, high FSH secretes, or like it promotes the secretion of estrogen. High estrogen promotes LH. LH, high levels of LH will promote progesterone.
Correct.
Okay.
Yes. Okay, already talked about this. Kayla?
Sorry, I just want to ask, in that plateauing of the estradiol, is that just to maintain, that's coming from the granulosa cells?
In the first phase or the second phase?
I guess in the, like the luteal phase or the